Principles like expressing empathy, developing discrepancy, rolling with resistance, facilitating change, and supporting self-efficacy are separate and interrelated concepts that people need to be aware of when they're doing this kind of work. All of these elements together are utilised to evoke a patient's movement in their chosen direction. And it's in what the words of Bill Miller is, "I believe what I say when I hear myself say it." With the element of expressing empathy, the clinician elicits from the patient in a non-directive and supportive way their concerns and feelings about their ambivalence and the changes they want to make. So in motivational interviewing, there are what's called AWRS, and AWRS is an acronym for open questions, affirmations, reflective listening and summaries. So weaving together these AWRS is how the skilled motivational interviewer keeps a conversation flowing towards change talk and resolving ambivalence. I'm sure many of you are familiar with open questions, and these are the backbone of motivational interviewing. What's brought you in here today? Do you mind if I ask you a little bit more about that? We always want to keep the conversation moving. Try to avoid yes-no questions, although sometimes they're useful to get some clarification. I think the other thing about the empathy part of motivational interviewing is that we want the client to do most of the speaking. So if you notice in your session that the client's doing about 50% or more of the talking, then you've probably got the balance right. If you're doing more of the talking than them, I don't know that you're in the territory of expressing empathy. And affirmations are always given as a statement, like most of motivational interviewing reflections. So for example, when someone comes in and shares something deeply personal, you might say, gee, that was a really big step in sharing that with me. So affirmations are this way of keeping the conversation moving, but also developing that deep sense of connection, which is the spirit of motivational interviewing. Reflective listening is one of the most important and probably challenging skills of motivational interviewing. What it involves is taking a guess about what a client might be feeling, trying to evoke from them what's sort of sitting beneath the surface. The best analogy I can give, it's a little bit like looking beneath the iceberg and reflecting that back to the patient in terms of a statement, never a question. So this is a skill that takes some practice to develop, but if you can get very good at it, it makes the process of motivational interviewing a lot more seamless. People often comment that to reflectively sit and listen to someone, it's probably going to blow out their clinic timeline. But the research says that if you can do it for about 3 or 4 minutes, generally speaking, that's all you need. We use summaries to acknowledge and empathise with what's been said, and then also kind of solidify some of the change talk language before we then move forward about making a plan. The goal of motivational interviewing isn't just to reflectively listen to patients. And in fact, it is a directive therapy in the sense that we're aiming to move our clients towards healthy behaviour change. So how we do that is by developing discrepancy. Now, if we had a drug-addicted person who had a very serious and life-threatening drug habit, we wouldn't sit across from them and merely reflect back to them how difficult or painful their situation is. We'd be trying to kind of get in there and help the person to understand their current state and how that differs from perhaps their ideal state. Finding out what really matters to people. Questions like, what matters to you? What is it that you want your life to be about? how does your use of drugs and alcohol get in the way of you being the person that you want to be? These are all really good questions that kind of drive a bit of a wedge between the person's current state and their idealised state.